Liz, you can. Thank you, Liz. Welcome everyone to this lovely August meeting of PHAB. Wonderful that you could join. I'm sure others will join us. So we have an agenda that reflects some discussions that we had at the retreat, and we'll be going over those, and we have some decisions to make about what we want here for PHAB, and we'll get into that right after we do some of our business. So welcome everyone. We want to approve the meeting minutes from the July retreat. I hope everybody had a chance to look them over. Are there any edits or changes that to the meeting minutes that anybody has? No? Okay, do I hear a motion to approve the minutes? Anyone?
Motion to approve.
Thank you, Chase. Any second?
Second.
Thank you, Steve. Okay, can we vote to approve? And actually, we have been doing it in the chat. There's some question by the county council whether that's okay. So there are only a few of us on. Can you raise your hand? Okay, we'll do it by raising our hand. I think these reactions, if you have a yay or a thumbs up for approving the minutes, and so we have 1, 2. Did I do that? Yeah, I did that. Didn't do that. 1, 2, 3. Any nays? I think everybody was a yes. And okay, so minutes are approved. Thank you, everyone. And we can move to a public health division update. Public health division update by Linan, who's so nicely stepping in for Dr. Cassirier, who I'm happy to say is on vacation. So thank you, Linan, for being here and helping us with this.
You're very welcome. I will do my best to fill in for Dr. K, and thank you for the opportunity. Liz, I'm going to go ahead and share my slides if that's okay.
Sounds good.
Oops, sorry. Let me try again. Okay, I'm not seeing anything. Hold on. Let me try one more time here. Okay, I don't know what's going on.
If you want to email it to me, Linan, I can try pulling it up on my end.
Okay, I'm just going to do my screen here and maybe that will be better.
Oh, yeah, there we go.
That's so weird. When I go to present, I'm getting a black screen. Are you guys seeing that as well?
Yes, it's all black. Yeah.
Okay, I'm going to go ahead and email to you, Liz. Thank you for that. Apologize if you want to just give me a minute. I've got it.
Sure, no problem.
Okay. Okay. I'll go ahead and just start by speaking a little bit about our current COVID numbers and what's going on in Sacramento County. So statewide, we're seeing a plateau of our numbers, and so that's a good thing. They are, it appears, according to our dashboard, that they're going down very slightly, but we consider it a plateau versus a downturn. And we do acknowledge that due to increase in home testing, that we may not be capturing all the positive COVID tests. However, we are getting the most severe individuals. We do believe we're able to see those through our testing numbers. And at this time, we are not looking at reinstating anything, any mask mandates. We are still strongly recommending masks, just as the state is, and especially when in crowded places, indoors, that type of thing. So that is basically what's going on with our COVID response. We did officially on June 30th deactivate our Department Operations Center, or Emergency Operations Center, and officially reactivated it about a week ago for our monkeypox response. So we had a couple of weeks without that, but we are back in response mode. Even though our COVID response, our Emergency Operations Center has closed, we are still doing COVID activities, such as lots of vaccination clinics in the community, as well as working with congregate shelters, working on outbreaks, and still doing COVID testing in our lab. Liz, did you get my PowerPoint?
I did not.
Okay. I sent
Maybe it'll
it.
come in just a second.
It's probably a delay because of the
Yeah, sometimes that definitely
server.
takes a while.
But Lynanne, I just got it. And I just wanted to let people know that I did turn off the chat per guidance from County Council, that folks should ask their questions and comments verbally. So please use the raise hand feature. And I think you should be able to, you can chat me. So if you're having issues with like being able to use that feature, then you can let me know and we'll figure out some sort of accommodation. So that is a change that County Council has requested. Yeah,
perhaps if they enter the question into the chat, I can just ask it, just note who's asking it and read the question. Maybe that would, I think that would suffice the rules of Bagley-Keene, or it's the Brown Act.
So I went ahead and made the chat so folks can still chat me. So if they're having issues with their audio, then we can definitely verbalize that question.
Okay.
Great. That would be really helpful for me too, because it's hard for me to sort of thumb through all of the participants and see that at the same time as presenting.
Yeah.
Okay, Liz, first slide.
Certain slides you want me to?
You can start on slide 2. Thank you. So the monkeypox is a variola virus, and it is endemic to tropical forested regions of the West and Central Africa. And, you know, there has been few cases, mostly in 2018, most recent in the UK and Israel, had imported cases from Nigeria. But in this year, we had the cases that are coming from non-endemic countries. And so our most recent spread, we are hypothesizing came from Europe, and we are still working on that now within California and throughout the country. Next slide. We are, as far as transmission, it is direct contact with the infectious rash, scabs, or body fluids. It is, they are looking at right now if it can be spread through semen or vaginal fluid. And it's also spread through respiratory secretions during prolonged face-to-face contact or during intimate physical contact, including cuddling, kissing, or sex within 6 feet for 3 or more hours. If you're touching items such as clothing or linens that previously touched the infectious rash or body fluids, and pregnant people can spread the virus to their fetus through the placenta. So that's our spread as of now. Next slide. This is the clinical presentation for monkeypox, and we have seen the pox in varied areas within our clients that we are screening. Because of the way that it has been spreading within our MSM population in Sacramento County and throughout the country, although it is not specific to just that population, it can be spread to anyone. It just so happens that that has been the current high spread. We have been seeing a lot of lesions in the perianal region, and it can be mistaken for other things, other sexually transmitted diseases. So it's sort of, no, not a lot of clinicians are familiar with
That's what we're
this,
talking about.
and it is something that it's hard to discern in some cases if it is monkeypox or another sexually transmitted infection. Next slide. So as far as Sacramento cases, as of Monday, we had 52 cases, but as of today, it's 63. So it is growing at an exponential rate. And this epi curve looks like it is slowed down, but that's not the case. As we get more cases this week, that last row where it currently notes 3 will definitely increase. So we are still dealing with a lot of transmission, and here's a breakdown of demographics also as to who has tested positive so far. We do believe that there's a lot that have not been captured though via testing, because we are constantly finding people, especially those seeking vaccination, that when we ask them the screening question, if they have any sort of a lesion on their body, and provide a safe space in which to discuss that, we are finding that a lot of people that have lesions are have had them for a bit and are seeking vaccination just due to being afraid and or thinking that that will help them. Next slide. So how we confirm diagnosis is by testing a lesion for the DNA. And we do have that testing available in Sac County Public Health Lab. It is quite an extensive run test. It takes around 4 hours run time. And I'm really proud of our lab for all that we've done to test while the state has gotten some commercial labs up and running. So if providers are going to request to have a specimen tested at our lab, they do need to get approval first, health officer approval. But if they are going to be using commercial labs, no approval is needed. And then we do send for confirmatory testing, monkeypox specific for the orthopox. We test, and it's positive orthopox at our lab. Then we test it for that confirmatory testing at the CDC lab. So far, we've released 133 tests from our public health lab. And this started on May 22nd. So this is not a very long time frame. The in-county residents that we've tested is 118, but we're also supporting counties in our region that don't have the ability to test. And we've done 15 of those tests so far. And Dr. K herself, I just want to say a little brag about Dr. K. She is, because our clinicians maybe had not been familiar with monkeypox testing and or maybe not comfortable, some of them within our clinics to test, she herself has been going in and testing in her spare time some patients, and just really proud of her and her leadership through this response. Next slide. So the vaccines that have been approved for monkeypox protection is obviously the traditional smallpox vaccine, ACAM 2000. Unfortunately, this vaccine has a lot of side effects, and so the state is not recommending it for use right now. Side effects including people getting smallpox from the vaccination. It can be a problem for both the vaccinator as well as the recipient of the vaccine. So we're using a vaccine called Jynneos, and our immunization
Lynette, I
program
think
is
you're
leading
breaking
that
out.
response. Limited supply. We did get patient, and we do have to request this. I'm sorry, can you guys hear me? I had an unstable internet for a second.
Yeah, now we can hear you.
Okay, where did I drop off?
I think you were talking about the approved vaccines part of it.
Okay, perfect. So the vaccine that we are using exclusively is the Jynneos vaccine because the ACAM has too many side effects. And they are ramping up production of this vaccine. We did get our phase 3A allocation this week. And I'll go in the next slide about how much we've received so far. But we do have to request these allocations through a formal process. Next slide. So to date, we have received not sure how that happened. I didn't press the mute button, so that was weird. To date, we have received 4,000, or that's how much we've been allocated, 4,728 doses, but 1,530 of those doses we don't expect to receive until later this week. We have administered ourselves 954 doses, and we have redistributed 2,205 doses to area medical providers that we deemed at highest risk for serving individuals that we are targeting for this vaccine currently, which are those that have been most affected by this virus within our county. So we are doing post-exposure vaccination for those that it's still effective, that have been exposed, and those are close contacts, as well as some pre-exposure vaccination. And so the criteria that we have for that is listed here. We do expect to expand this criteria as we get more vaccine so that we can serve even more individuals that could be at risk of contracting monkeypox. Next slide.
Lynanne,
yes.
So we have two questions related to two of the past slides. Sarah, do you want to come off mute and ask your question?
Sure. First, thank you so much for taking the time and stepping in and providing this. It's really helpful as we all sort of track what's happening here. I would just, one question, I guess, for both elements, but are we able to meet the demand for testing? And then likewise for vaccine, I'm curious what the demand looks like and if we're able to meet the demand for both testing and for provision of vaccines. Thank you.
Yes, so we are currently struggling to meet our testing demand, I will say. We are doing it out of our sexual health clinic for the county, the testing that we're doing. And we have limited space within that clinic, and we're also trying to serve our HIV clients, as well as those clients that come to us for STI testing and treatment. So, and then provider capacity is also, we're trying to expand that as far as more of our providers being able to test, because
So
Dr.
it's both
K,
a commodities issue and a provider. Is that what I'm hearing?
well, for us personally, but we are
Okay.
also working with area hospitals to see how we can increase their capacity to test, because this shouldn't, just be the county that's testing. And we do have some hospitals that are
Right.
testing, but we also have some hospitals that are turning clients away and or
Okay.
sending them to the ER where they don't want people to be sitting if they have monkeypox.
Yeah.
So
Right.
we're working on building capacity in the testing area. And then for the vaccination, we definitely do not have enough vaccine to meet demand. We have been able to date with our clinics, serve most everybody that has shown up to those clinics. And I'll talk a little bit about how we're partnering with some community-based organizations to conduct those clinics. But we're also, our providers that we've given the vaccine to, like Pucci Pharmacy, he says that there is just way more people than, who he every week he is using all of his allocation, and we're giving him a good amount of vaccine. So as we are using every dose that is being allocated to us, and the vaccine amount that we're being allocated is still not sufficient. But I would say that that's probably likely to be the same in most jurisdictions that have had an outbreak so far.
Thanks, Lynanne. And I see Steve has a question, but before that, just Scarlett, would you like to take the questions throughout, or just mindful of your agenda? How would you like to do that?
I think, yeah, we can take the questions throughout. And I know there's another one about COVID that we'll circle back to. But Lynanne, how many more slides do you think you have?
Not very many more. Yeah.
Oh, okay.
Okay. Steve, why don't you ask your question if you're comfortable? Do you want to come off mute?
Sure. Several slides back, you showed a breakdown of I think the individuals who tested positive by age group, but you didn't show a slide around by gender. And so this slide makes me wonder what that breakdown is.
Yeah, so far my understanding is that it is all. Hello, can you hear me?
Okay. Could
Okay, I'm
everybody
getting.
not talking mute, please? Thank you.
So far, my understanding is that in the data that we've collected, that they have been males.
Okay.
Thank you.
Okay.
Okay, next slide. Thank you. So the treatment for monkeypox is TPOXX, and this is under investigational new drug application. And what it's really trying to do is to reduce the infectious period and the complications that are the result. And providers that are doing most of the testing, UC Davis has really been our rock star for this. We are so grateful to them for all the clients that they've provided treatment on. But Kaiser is also working on this, and Sutter is going to be coming on soon. So again, we're building capacity within our provider network for this treatment too. We do have 34 patients that have been enrolled in the treatment to date. And again, 11 of those were out of county. So, and I just want to highlight that even with our vaccine response, we're serving people from out of county, the greater Sacramento area. At a couple of our clinics, it was determined that 25% of the clients that we served were non-Sacramento County residents and were from instead surrounding counties. And other health officers in those jurisdictions have sent a letter to California Department of Public Health asking if we could get additional supply because we're serving their residents, and they want to make sure we can continue to do so.
Good.
Next slide. So something with this that has obviously been very important is community engagement, collaboration, and outreach. And it's been sort of tricky because we don't want to add to stigma, right? Because it's not just the highest risk populations that have contracted the virus to date that can get the virus. Anybody can get the virus if they're in close contact, as I sort of went over previously. Next slide. So the sexual health promotion unit in public health has been instrumental in helping us with this community collaboration. Next slide. We developed messaging. We included our partners in our process and have leveraged them to assist with getting information out. Next slide. These are some of the products that we came out with via media. Were a lot of social media outreach, a lot of traditional information outreach. Next slide. Also working on things for school-aged kids, junior high and above, because there's going to be a lot of questions when they come back as to how it's transmitted. So you'll see these don't include a lot of the MSM information and is more sexual health education specific. Next slide. And then our community-based vaccination efforts, we have worked closely with some key community agencies that have helped us to get the word out and register people for the clinics. Next slide.
Lynanne, can I just
Yes.
interrupt? So we're pretty much behind schedule quite a bit
Okay,
now.
we're almost done, I promise. But I can also stop I can just say that it's Golden Rules Services, Harm Reduction Services, SAC LGBT Center, Sunburst Projects, Poochie's. I mean, these have all been instrumental partners for us throughout our efforts. So
That's really wonderful to hear. And we will distribute the presentation and have it on the website so the members can go and look, and at the next meeting, or if there's some pressing issue, they can send questions to me and I'll forward them if they want answers before our next meeting.
perfect. The other thing I would just like to mention is that we have been doing a lot of concurrent testing of people that come in for our monkeypox testing. We're testing for other STIs and HIV as well to make sure that we're capturing and also able to differentiate diagnoses. Okay.
That's terrific. That's really a great opportunity. Thank you so much. And I'm
You're
sorry
welcome.
we didn't have time for all of it, but
No worries.
really appreciate it. Okay.
Was there a COVID question? I think I heard that there was. And
There was a COVID question about, Liz Blum wanted to know whether COVID, I think if you were sampling for, let me see where it went. Now,
I think it was sewage.
sewage data for COVID rates. Yeah. I know
Yeah.
UC Davis was doing that, but I'm not sure the county is.
Yes, I believe that the state is doing it on our behalf, but our epidemiology, Jamie White, would be better to speak to that. But yeah, they are doing wastewater sampling still at the state level, and they are sampling various counties.
Matt, do you have a very quick question?
Very, very quick. I just want to know more about the monkeypox and the rolling out into the community. Like, I'm in queer spaces. There isn't much information on it right now, but I also want to just name that even though like there is this prevalence in our queer community, that our queer district in Sacramento is surrounded by a bunch of hetero culture. And so it's a shared space with it. So like we're constantly, you have straight folks inside of the depot and America, all that stuff all the time. And so like, I just see this weird hotspot happening around Lowbrow, Golden Bear, and things like that. So I guess that's my question is like, what kind of rolling out to this vicinity? Because it can't just be queer spaces. It's like it's like city blocks. And so, yeah, just wondering the timeline to where like maybe we'll see some of the flyers into the spaces and stuff like that.
Yeah, we've tried to be very careful in our messaging, because we've been told by our partners that if we are messaging out to the general public that it is these highest risk individuals that to date that have tested positive, and we start, they want us to be very careful in our messaging to make sure that we're not adding to stigma within this population. That being said, I agree that we need to have more information out to the general public. Right now, we've been really trying to build capacity and putting a lot of that information on our webpage. But I think part of our next phase in this response, which we just started our Department Operations Center this week, at the end of last week, will be to how can we fortify our messaging to the general public, the hetero spaces that you mentioned. So I really appreciate you bringing that up.
No worries. And just being a community member of queerness and transness, welcome. If you need any support with language and things like that, I am on this email list. I would love to support in inclusionary conversations.
I love it. Thank you.
Of course. Thank you so much.
That's wonderful. Yeah, thank you. Well, thank you, Linan. Appreciate it. We're going to move on. Dr. Damiano's here with us. I know you're going to give us a brief update. Thank you for joining. I know how busy you must be. Maybe I don't, but I'm imagining.
Well, thank you. I'll make mine pretty brief. I know you're behind schedule and I have to get off for another meeting anyway, but just at a department level, the brochure for the director position was released and they are anticipating interviews in late September. So hopefully there'll be a great candidate for the job. I'm currently doing the primary health division deputy director interviews also. It's going slowly, so I'm hoping for a really good candidate. The department is working on the CalAIM and the Social Health Information Exchange projects, initiatives. So if you want more information on that, I could have Janine come to one of the meetings and do a short presentation or a longer presentation on either topic, if you wish.
Thank you.
I know the jail working group for this group has been interested in these consultant reports. There will be a rollout of a PowerPoint at the Community Corrections Partnership on Thursday morning, which is tomorrow at 8:30. And it is a presentation on the Mays consent decree and then on the 2 consultant reports, which will be released shortly. One's on the main jail population, what can fit within the main jail, and the other one's on population reduction and strategies. This is an open meeting. It's available by Zoom. I think I sent you the link. The presentation for the Board of Supervisors, as soon as it gets put on the agenda, I'll let PHAB know, but I believe it's going to be mid-September, around September 14th for the Board of Supervisors meeting. And so I'll let people know at that time. For adult correctional health, I'm sorry, there's no big report this week. There's a lot of reorganization that's happening and some of the people have left. I can tell you that although the countywide COVID levels are going down, which we're really grateful for, we are having a 4th outbreak in the jail facilities over at the branch jail. And so last week on our dashboard, we had a net increase of 31 cases. And this week, you're going to see 108 cases or somewhere around that figure. This morning at 6, we had 2 cases at the main jail that were in current custody and 106 at the branch jail. Our ADP has been around the 3,400, 3,500 plus level, so pretty high. And what's happened with the variant, when we detect it, when we get in the process of detecting it, it's almost too late. It's extremely contagious, has a very short exposure window. And at the branch jail, we have a lot of dormitory housing. So it just kind of spreads rapidly at that facility. So we're hoping that we're ending this community transmission rate because that brings it into the facility. And it's just very hard to have that COVID operations. I wanted to just update you on one other thing. It's on the vacancies. I think I've been sharing with you the workforce shortage that's happening actually all throughout the county and through a lot of other sectors as well. The Board of Supervisors did approve 39 new additional positions for correctional health at the budget hearings in June. We concluded our labor negotiations with 3 of our health services contracts, our labor groups, in June and July. And then we received the new positions in mid-July. So fairly recently, we got the positions. And then in July, the board had to approve the labor agreements for the nursing and the physicians and dentists. Once the labor agreements are concluded, then they have to approve them. So right now, what staff are doing is they're having a series of meetings with our personnel department recruitment team. We're trying to update flyers, and we'll have a correctional health job fair. So we're trying a wide net to get openings for all of these licensed medical positions. In the department's behavioral health space, they're also experiencing workforce shortage, which is impacting them in terms of rolling out all of their behavioral health initiatives. They're also working with our personnel recruitment to do a behavioral health fair. So hopefully we will get some good position. So right now for correctional health, there's 62 vacancies of permanent positions.
Wow.
Yeah, so that is my report. And I think Lynn had a question.
Yeah. Lynn, you want
Thanks so much, Sandy. Oh, thank you, Farlette. Thank you, Sandy. Sandy, lots of great information. Really appreciate it. I'm wondering for YDF and Voya, is correctional health involved with YDF and Voya? And if not, who is? And if you could report on those data too about COVID and anything else that we should be concerned about.
Yes, so COVID is also COVID. The juvenile correctional health is also under the primary health division. And let me see, I think I got their last report just really recently on Monday. And they had tested 17 youth. They had 1 confirmed case. They only had 117 positive cases throughout the entire pandemic.
Wow.
So they have a much, much lower volume, as you know, and the census is 147. They have a much lower volume and way more space in their facility.
Right. They're reporting over the past couple of weeks, so they've actually closed down different units. And so that's why I'm wondering, trying to correlate the closure of the units with the COVID reporting.
Yeah, so did they say it was due to COVID?
They did.
Okay, so what happens sometimes is you'll have these people that have had an exposure. So if you have a positive confirmed youth, and we had one last week, you have to do contact tracing. And then anyone that had potential exposure, you put them in close contact quarantine, and then you start the testing series. And so even if you have 1 positive case, depending on the number of contacts, you could close down housing units. And that's happening at the jail all the time. It takes up a lot of real estate. And then you also asked about the Voya, and the Voya population was 17. And the current population of the jail, the YDF is 147, which is higher than normal. I think it's raising a bit because of that population.
Can you
Thank you
define
so much.
Voya for everyone on the call, please?
Oh, it's for their young adults that are back from the, that are no longer going to go to the state facility. And I can never remember the acronym, so I'll have to look it up for you.
It's right. It's something Oaks Youth Authority.
Yes.
And it's basically the YDF side is for pre-conviction, and Voya is post-conviction.
Thank
So
you.
we can think of it easily like that.
Yeah. But it's a new effort for our juvenile correctional.
Valley. I just thought of it. Valley
Yes,
Oak.
you're correct. I can never remember it.
Yeah, Valley Oak Youth Authority.
Thank
Very
you.
good.
And
Okay.
Sandy, there was another question that came in. When will the consent decree consultant reports be publicly available?
Well, I don't have the release for that, but I believe either after the CCP meeting, which is Thursday, or right during, close to the Board of Supervisors hearing. As soon as they become publicly available, I will notify Farla so she can let this group know. Because I know you've been tracking that and you're very interested.
Thank you. Great. Thank you very much. Thank you for being here and giving us that report. I'm sorry for the outbreak. Hope that gets resolved soon.
It will.
Thank you. Good. Okay. Lori, you're up. Thank you for joining. Lori Miller is going to give us the substance use prevention and treatment update. A brief one today, please.
Yeah, it'll be brief. Good afternoon, everyone. I'm Lori Miller, Behavioral Health Division Manager over Substance Use Prevention and Treatment. And Liz, if you want to go ahead and share just the flyer on the upcoming initiatives and updates, I will go through some of those. This first flyer is actually a resource handout that you can review at a later date, but I'm just going to go over this upcoming initiatives and events flyer for you, and not everything on this flyer. I want to target just a few things. So August 11th is our Methamphetamine Coalition. We will be focusing on reaching diverse communities, providing an update on the program that was formerly known as the SURE program, so some substance use, respite, and engagement. It's now renamed to crisis response in behavioral health. So we will be providing an update on that for all of you. Moving down in this document, keep scrolling. These are some of our subcommittees of our Alcohol and Drug Advisory Board. The next event I want to highlight is August 21st, which is our first National Fentanyl Prevention and Awareness Day. As many of you know, we are still being devastated by many deaths here in Sacramento County due to fentanyl poisoning. In the first 7 months of this year, we've lost 50 people. And what's interesting about this is the demographic is starting to change. We first saw last year when we lost 116 people, they were young people. They were your high school and early college age. And this first 7 months of this year, we're seeing the age kind of rise to individuals between 20 and 30. So we're not sure why that is, but we're still keeping an eye on the young people and focusing a lot of efforts on our youth and young adults. So this is the first National Fentanyl Prevention Awareness Day, and we will have some county displays in particular areas around Sacramento, and I'm hoping to have one there at the health center. Moving down in this document, again, these are some of the subcommittees of our board. August 31st is Overdose Awareness Day. And this is a day, again, that we will highlight just due to the overdoses here in our county and the opioid epidemic that continues to devastate our communities. September is National Recovery Month, and we usually celebrate this month by having an annual event called Recovery Happens, and it is an event that happens at the west steps of the state capitol. It's an all-day event starting at 8 a.m. There's a pancake breakfast, a recovery walk, lots of resource tables, so please come out and join us. Several speakers celebrating Recovery Month. Moving down in this document, October 11th is an Opioid Awareness Summit for educators and public health professionals. So this is a free event that's happening at Sac State, October 11th, 8:30 to 4. We're hoping for about 300 people, and we plan on providing lots of resources and some free Narcan during that event. Again, moving down, our Opioid Coalition meeting is October 17th. And then there is a virtual cocaine, meth, and stimulant summit coming up in November. Encourage all of you to participate in this virtual event. I attended last year, a lot of great information, and Dr. Andrew Mendonca, who is now over in Primary Health Division Manager, and myself will be presenting one of the sessions during that stimulant summit. And then some other things happening at the end of the year. But I want to just end with the fact that Sacramento County continues our Narcan distribution program. And so we are distributing Narcan in most of our public facing lobbies throughout the county. And any agency or facility or organization that wants to order their own Narcan, there's a way to do that through the Narcan distribution project with the Department of Healthcare Services. But if it's a county-based public-facing lobby, my unit will be happy to support you in providing some Narcan and then training staff on how to administer it and then order their own in the future. So I'll continue to provide more updates in the coming months, but I'll keep this one brief. So if you have any questions for me, that's all I have. Thank you.
Thank you so much. That's a lot going on. That's terrific to see. And yeah, we'll keep that calendar foremost and post it on the website, and people can hopefully partake in some things.
Thank you.
Thank you so much, Lori. I don't see any questions, so we will move on. Okay. So as you know, we had a retreat that was very successful. It was, we got a lot done, and we have a lot of food for thought and information, and we have a lot of decisions to make. So I think I'm gonna share my screen and show you where we're going today in terms of what to talk about from the retreat, if in, or comments about how they thought it went and what they're looking for after, and people who weren't there can get a sense of what was discussed and what we're going to focus on. So let me see if I can get a gallery up so I can see if there are any questions. Just raise your hand if there are. Whoops, it won't do that for me. So anybody want to make any comments about the retreat at all? Just unmute and jump in, and I'd like this to be a discussion. Okay. So we had a wonderful presentation by Dr. Kassirier. She brought, and it is posted on the website under our presentations, which are very nicely labeled. Thank you to county staff for doing that. I'm sure Liz was very helpful in that. So she presented interesting information about the rates of death or years lost in terms of disease or death. And interestingly enough, these top four that you're looking at here, the Alzheimer's, drug overdose, mental health, and diseases of despair, and maternal and child health, were at the top. And we asked Dr. Kassirier what her options would be. I mean, I'm not saying that Alzheimer's was the top of the list, but we know that heart disease and cancer and other things are there. They're always there. But this was shocking, where it stood, where Alzheimer's and dementia stood in that list, as well as drug overdose. Drug overdose has gone up tremendously over COVID. The deaths, especially for certain populations. So that was of despair that just came out from CDC a couple of weeks ago. And I don't think it's that much different for our county. It was across the country. But these were the priorities up at the top that Dr. Kassirier highlighted with her data that she presented. And afterwards, we had breakout groups, 2 groups in discussion. And these are the priorities you see. And you can, is it large enough so you can see it? I think it should be okay for you, even on a small screen, but I'll make it bigger. So these were what the data for decision-making, which was something that we requested. We're going to request from the county. It was a very broad kind of area that needs to be kind of willowed down into more focused areas of data that we're going to request. And we did get a number of dashboards sent to us that the county has, but I think today we'll have a discussion about what exactly we want to ask the county for in terms of data, so that we can make informed decisions about our priorities as a board. So but certainly what came up in the retreat was these diseases of despair by age and categories, dementia and Alzheimer's and homelessness. So I'm going to stop here for a few minutes and discuss this, because I'd like to get feedback from the board on what it is that we're asking, so we can get more data. I don't know if people had a chance to look at the dashboards, but if we're going to ask the county, I want to be cognizant of their time and staff available to dig into the data for more detailed analyses. So does anybody want to discuss that?
Carla, can you hear me?
Yeah, I can, Libby.
Great. Hi, everyone. This is Libby. I apologize. I am on vacation and at a restaurant, so if there's some background noise, I'll try to keep it short. I mean, I think just to answer your question, Carla, from my group, and I'd love to hear from the Kalu and Dr. Ashley and the others who are in the group, what we're interested in was looking at some of the priority disease areas that Dr. Kassiri highlighted, kind of crosswalked against demographic and disparity data. So we wanted to understand sort of what is the profile of the burden across age, gender, geography, race, ethnicity, and try to use that to try to understand sort of like how to target the focus, and also maybe have some conversations around what are the root causes. So what are the kind of root causes of drug overdose? What populations are we talking about? Same thing for mental health and diseases of despair. We had some questions around how much that intersects with the experience of houselessness. So I hope that answers your question, and I think gives a sense of the kind of data we're looking for. Would love to hear from others who are at the retreat as well, to shed some light on some of the specific data intersections we wanted to look at.
Okay, so a lot, I don't know if anybody had opportunity to look at the dashboards. You know, as usual, the county does break things down by age and gender and a lot of these categories. And so I think first we need to look at the dashboards and see what is there that we want to use and what is not there that we want to ask for. So I think by houselessness might be one that is not up and on these in these areas. Those breakdowns, I would imagine, aren't there. I would think that, and geographic, when you mean that within the county, how refined is that category? I mean,
I would imagine it's a function of how the data are available. So if that's by neighborhood, however it's carved up, but if they have those data, I think we're trying to, just narrow in on one of the populations. We're talking about neighborhood as proxy for socioeconomic status if we don't have those data specifically.
Okay. So I'm not adverse to asking them to do some data digging. I just don't want to do too much, but that sounds reasonable if they can access the data with reasonable effort.
I know there were others at the retreat and we all kind of circled around this data point. So would love to hear from others if I've missed anything.
And I'll just note that I see some county staff and community members' hands, and we'll circle back to you all after we get a chance to hear from the board.
Yeah.
I think Farla, I'm sorry, this is Sanal. And I'm going to try and also relay some of what I think we talked about, but also back at the retreat, but also maybe think a little bit more about your comment about trying to be mindful of county staff capacity, plus also sort of meeting, I think, our goals. And I think a little bit of what we were trying to get at is, you know, to the degree we're identifying like a new issue or new data point that is changing over time, how can we use that information for, I guess first, how can we access that information? And then second, how can we use it to potentially pivot as needed? I think that's one thing like our group talked about at the retreat. And I'm curious, I have not looked at the dashboard, so I just want to put that out there, but I am sort of curious to, upon my review, to better understand how does the county share new information, or how does the county illustrate when things are changing in the data? And I think that's something we were kind of curious about, because that might inform sort of future activities, or if we need to pivot to, in this, like where we're at right now, maybe monkeypox. And I think some of this we learn through our conversations and the debriefs we get from county staff already. But I think a lot of those, because of our limited time, they're sort of like the one thing that's causing a lot of concern right now. But, there might be other things as well. I thought the point that came up earlier from Lynn about the shift in demographics of individuals dying from fentanyl use was actually very interesting. So I think that's just something that I certainly took away. It's like, maybe this is one way in which we can be mindful of staff capacity, but also help us in our decision-making as a board.
Mm-hmm. Yeah, thank you. Okay, noted. So that's for things that are changing more than not, right? And being kept up to date on those issues. Okay. Yeah. And so is there discussion about these areas that have been identified? Do people have anything to say about them? We're going to gain more information on them in terms of data, but any comments about, and this is I think at this point we will adopt these in the near future, that as priority issues, and people can comment on that as well. In the meantime, while people are thinking about that, members are thinking about that, Lori had her hand up, and I thought Lynn did. I'm not sure if she's still on. Yeah, so Lori, can we hear from you?
Yeah, Liz, if you can scroll down just a little bit, I will just, respond to the board here in terms of, I can be a great resource to provide some of this drug overdose data. We certainly have the data of individuals entering into our substance use treatment system, so I can get you demographics about that. But where I get most of my real-time data, because the dashboards are very behind in the data, is through the Sacramento County Coroner's Office. So I get quarterly reports on certainly the fentanyl poisonings and overdoses, because that's what's trending right now. And of course, methamphetamine, which sometimes is forgotten and overshadowed due to the opioid epidemic. And we actually see more fentanyl deaths than we did, more meth involved deaths than we did fentanyl deaths. So we had 68 meth involved deaths during this county in the first 7 months, and then 50 fentanyl poisonings. So I can provide that data to you, and they do give me a breakdown in terms of age, but not too much other demographic information. But I can certainly be a key person to provide the drug overdose data where I can.
Thank you for that.
Yeah, two other points, Farland, just kind of responding to how the board can help in these various areas. I wanted to propose maybe in a future meeting around obtaining more real-time data through what is called overdose mapping. And I don't know if this board has any information about what overdose mapping is, but it's actually a system that can get real-time data in various neighborhoods, and it maps out kind of trends in the community. And I'm working with a public health analyst right now, trying to get more support around this. So the board, if maybe a future presentation, I would really like support from all the county departments, which we pretty much have right now, but to really move this overdose mapping project forward. And the public health analyst I'm working with is supported by the CDC and the CDPH on an overdose response strategy. So I hope to be able to bring her to this board to review what that is, so that this board can be supportive of this overdose response strategy and related to your drug overdose priority. And then also trying to support overdose mapping to get more real-time data.
Yeah, that sounds great. I think it would be really good for us to hear about this. I'm not familiar with overdose mapping, so I think that's a great suggestion. Thank you, and offer.
You're welcome.
Appreciate that. Lynn, you had a question?
Yeah, a couple. So I guess to follow what Lori's saying is that I work at a lot of the intersections here between, especially with youth. So youth who are between the ages of 12 and 24. And I think I'm wondering how open are you to receiving information after today about questions that the community might have? I'm working again with at the intersections of criminalized youth, education, academia, community health, and mental illness. And so I'm just trying to end substance use. And so all those intersections house that population. And so I'm really grateful to see adolescent and childhood data on there. And I'm just wondering if, one, are you considering doing some participatory action research in that community, and how can we be helpful? How can we be helpful? And are you willing to receive some questions from the community to add to this or to add to your data request?
Definitely. If you're asking PHAB, we are always, I hope I speak for everybody, always willing to hear and eager to hear from the public and receive help, assistance in any way. I mean, that furthers the purpose of keeping people healthier and safer. Absolutely. And I think Lori also, I speak for you too, I hope. Maybe we can talk about how to facilitate that, Lynn and Lori, and sounds terrific.
Absolutely. Mm-hmm.
I will be in touch. Joe Phil, I'd love to hear from you. Hi.
Hey, good afternoon, everyone. Thank you again for the time and the sharing, and I really appreciate the county staff for their willingness to engage with us and working with us in the future on this. And Dr. Damiano, I'm glad to hear that you have a public health analyst that can work, and I'd love to offer my support. We have a lot of existing data from CHCF, so that's the California Healthcare Foundation. CHHS has an open data portal on emergency room visits. HCI, formerly OSHPD, also has the ED10 data that can be in a running 3 to 6 months, depending on how you would want to tabulate and validate the data. And then CHHS also has the Healthy Communities Index, California Health for All. So I guess what I'm trying to say is that the data request is not just anonymous to our county. It's something that's already being done in spaces outside of our county, but our county has actually been providing some of this information directly to the state leaders. And so instead of having to reinvent the wheel, we can actually just leverage from existing data sources and make qualified and quantifiable decisions as benchmarks as we're looking for these determinants of care. So again, I just want to reiterate that for the rest of the board, that this is available things. We don't have to kind of put more work from our already exhausted staff, and we can hopefully, and supporting our team in the county, be able to find these existing information, put them together, and maybe make reasonable decisions or at least recommendations moving forward. But I, for one, would love to work with your analyst, Dr. Damiano. I'd be more than happy to help out. And if we need to, PRA the state for some of this information that we've already been providing to them to make it easier and easily digestible, I'd be more than happy to help out with that as well. So thank you again, everyone, for the time, and pass it on to you, Dr. K. Or Kaufman, sorry.
Thank you very much, Joe Phil. That sounds very, very interesting and probably very fruitful. We will follow up with that as well. Are there any other comments or questions about this area? Okay. All right. Hopefully we'll come back with data. Are there people who on the besides Joe Full on PHAB who would like to work on this effort? Please let me know. Send me a message or reach out to me afterwards. This would be excellent, I think. And I don't think it would be a very long time or extensive involved time commitment. So if you're interested in this area, please get in touch with me. Okay, another issue that was on the that came up during the retreat was meeting schedule. One option for various reasons was to meet after work hours, and if that would be possible. Certain people were interested. I'd love to hear from everybody today. Part of this is because not everybody can take the time during lunch easily. And I think also because we are looking for a youth member, that we want to make it a convenient time for youth, whether they're in school, college, or other areas, as well as just to make it easier for people to, some people feel like their attention is scattered because they're trying to attend to other things during workday, even though it's lunch hour. And I was exploring a little bit about how this would work. I think that there are other boards who do meet later in the evening. So it seems possible. We might not have as much support staff, but that we'll see how that might work. Are there, I'd like to hear from everybody about this. Is this something that would interest you, would work for your schedule, that you're really invested in having happen? Just, you have to speak up now because we've disabled the chat.
Like Farla, this is Sanal. I am a huge proponent of this. I think I've conveyed to you and other few folks. I know it's just really hard for my work schedule, unfortunately, and I often am distracted with other things that are happening with state work. So I would certainly love to see some kind of, even if it's, I don't know if this is at all reasonable, but even if it's maybe like every other meeting schedule where we do it after hours, if it's a support issue. And I think even like 5 o'clock would be wonderful. But even later than that would also be amazing. Or, I don't know what our options are based on everyone's availability, but I would absolutely love that. And I think it would also allow me to just participate more, be more attentive and focused, and really just prioritizing like the work we're doing here. So
great to hear that. Good, we will explore the possibilities. Other people, Steve?
I'm open to it as long as, I have other standing meetings scheduled during the evening, so it would matter what days, what times. Wednesdays wouldn't work for me.
Okay.
For an evening meeting, but let's do a poll or something to see what would work for the board.
Okay, I'll see if we're allowed to do a poll, like out of the meeting. I have a feeling not, but I'll just check on that. It's not a vote, so maybe a poll would work. Never know with the Brown Act. Let me ask people, especially those who wouldn't think it would work for them. Are there people who just say, no, that's not going to do it for me? I'm not hearing, I'm not seeing.
Carla, I'll just share that, the Alcohol and Drug Advisory Board meets in the evenings, 5:30 to 7:30. I'm on the Mental Health Steering Act committee, and that meets from 6 to 8. So these boards can be very successful meeting in the evening. I will say though, in terms of your desire for youth participation, it's much easier for youth to attend in the evenings than it is during the day. Lots of boards that I'm on right now are in the recruitment process themselves, and it's been very difficult to find youth that can participate during the day. So that's just something to consider. But certainly my unit, Substance Use Prevention and Treatment, will prioritize this board moving forward, regardless of the time.
Thank you so much. I really appreciate that information. That's very helpful. Thanks, Lori. Okay, I'm not hearing from people. All right.
Yeah, just to say, Farla, that the later time would be preferable for me as well.
Thank you, Libby. Excellent.
Yeah, and this is Sarah. I mean, I defer to the group on this one, and Although I was a little bit like, oh, she's on a lot of boards already in the evening, right? So I don't know how much of that happens with other people.
Okay.
But just to be sensitive to that, I'm supportive of it, especially if we can engage youth and it makes it easier for them to access the opportunity. Thank you.
Great, thank you.
Same here, Farla. I'd be supportive in the early evening or late afternoon. My only conflict would be planning commission meetings for the county, typically are Mondays.
Okay.
And so we just have that's but I can probably work around our meetings or every other week. Thank you.
Thank you. Okay. Well, does anybody have any objection to a Thursday meeting?
So I'm wondering, Farla, hi, this is Sarah. I'm wondering if dare I say, probably Liz has a better mechanism, like a doodle poll or something, so people can sort of just make sure they look and then commit. And I'm not sure if we have like full representation, all of that, just a suggestion.
Yeah, we're only missing one member, and I will check, but as I said, the Brown Act is pretty pretty constraining, to say the least.
Oh, that's right. Okay.
Yes.
Sorry.
So I'm not, not
Sorry.
sure if you can do it that way. But I do want to hear more if somebody has really a problem with it. I love hearing that the people who support it, but as you said, it's kind of a long process here. So anybody really really adverse to having like Thursday evening meetings? Okay. All right.
Carla, not strongly adverse, but all else equal, I'd have a preference for earlier in the week. I can make a Thursday work, but if we're going to do after hours, I think Tuesday or something would be better. But it can be flexible.
Okay. Thank you.
And maybe try to check the weeks, Farla, of the other boards, like our Alcohol and Drug Advisory Board meets, I believe, the second Wednesday of the month. Our Mental Health Steering Act Subcommittee meets, I think, the third Thursday. So maybe, take those into consideration.
Yeah.
For other boards meeting.
We generally have those on our on our agenda, so we can easily check those. But it would still probably be the first week of the month. Okay, thank you. I'm going to take that as a.
And Farla, just one last thing.
Sure.
Once we go in person, we may want to check with county staff to see which meeting spaces are available.
Yes,
well.
and that is an issue. Yeah, the after hours is an issue for meeting space, so I will have to check on that. But I will come back to you with all the information I can gain on it. All right, so let me go through some of this meeting format. Some of the things that we talked about was not just the time of meeting, but the format when we have topics that we're addressing or wanting information about and our priority issues. Sometimes the panel style would be a better format to get different people from different entities in to give short presentations and then have a discussion together, and we could have everybody in the same room. I think that was one format that people thought might be interesting, and I've been thinking about that for a while. So if you have any objections to that, let me know, or comments. As well as specific goals for each meeting was brought up as a thing that we should set. A lot of times we're just trying to understand the landscape, so it's not so easy. I mean, that's a specific goal, so that's pretty obvious, but that was thrown out there. Creating space for discussion. I have to be honest, this board doesn't always have a lot of discussion around things. We have a lot of dead space, and I'd love to change that. People should be feeling free and, having no problem of voicing their opinions and getting into a discussion, asking a lot of questions. I'd like this to be a place that people feel safe doing and engage in. So one comment at the end of this, you see, is members turning on their camera to make this a more interactive and engaging meeting. So I would encourage people to do that in the future whenever they're comfortable with it, or to step out of their comfort zone a little bit and do it. At some point, we may be in person in the near future. I don't know the rulings yet about the Brown Act, but I'm hoping that there would be some accommodation that we could do a hybrid format, because that would encourage more participation by the public, I think, and enable people who can't make it all the time to be in person to attend. So that's another thing that we discussed. More open discussions I just talked about, please. I think that means, just having a lot of back and forth or questions asked. I think that's what that was asking for. And there was talk about having the county send updates in advance, and Dr. Damiano has been great. I know she's really busy right now, so that wasn't possible for this meeting, but in the last number of meetings, she has supplied updates beforehand. If we are good about going over those and formulating our questions beforehand, then perhaps the updates can be a little more streamlined. That goes for all of the updates. I would even ask public health, but Dr. Kassirier and maybe Lori to do it as well, so that we have more time during our meetings. Another option that was put out was county updates every second PHAB meeting. Thank you, Lori. I'm not sure how I feel about that, but does anybody have strong feelings about not having an update every meeting, maybe just getting a written update and not having the possibility of asking questions? I think we have to explore whether we can streamline the presentations enough to have them at every meeting, or it's possible. I don't know how people feel about making it a 2-hour meeting if it's in the early evening or late afternoon. Any comments about that one? Okay. 2-hour meeting, anyone?
Hey, Farla, if I could just lift up, this is Liz, something that related to this that I heard at the retreat as the sort of scribe / facilitator, is coming back up to your, what you brought up at the beginning of the meeting around those priority areas.
Yeah.
And the data folks want, because I think that what I heard a lot from the retreat was having the meeting format follow whatever the priorities are that are identified by the PHAB board. So I think it might be hard to answer the question about those county updates until PHAB decides on what their priority topics might be for whatever span of time PHAB's looking at. Something to consider that I felt like I heard during the retreat.
Okay. Does anybody have any comments about that comment?
Okay, sorry, I wasn't quite catching. Can you summarize that again, Liz? My apologies. I was trying to follow and I'm not sure I got the gist of it, maybe.
Just that PHAB during the retreat indicated that the meeting formats should follow whatever priorities are identified.
Oh, yes, correct. Thank you. Okay, Chase. Yes, I remember the discussion. Thank you. Thanks.
Okay.
Well, I think it would be useful if we have priorities, right, as a group. So within the agenda to ensure that we touch on those and sort of see where we are and how things are moving, whatever is happening within them, right? That makes good sense.
Yeah, I think there was discussion about maybe not having the updates when we have like these panel discussions where we need a lot more time. because there are different entities there and we need time for certain information to be presented and then certain discussion to go forward and time for questions. So yes, thank you, Liz, for bringing that up. So, and maybe we can explore trying out different formats for different meeting agendas. Okay. Does anybody, I'm going to move on because it's getting late. Certainly you can send in some comments. You can send them to Liz or NCC me if something comes to mind after the meeting. But I'm going to ask here for a volunteer about the youth participation aspect. We would like to recruit somebody to sit on the board and represent the youth demographic in the county. I know Sarah's commented in the past, very interested in this area. I don't know if you're willing to take that on, but
sure, I can. But probably would not. Very happy to do that. Just probably wouldn't be able to start on it for another like maybe week potentially. Well, definitely at least 1 week, maybe 2.
Oh, absolutely. No.
Yeah.
That would be great. And if anybody wants to help out, just reach out to Sarah. Always more is better. And Sarah, always keep me up to date. And if there's anything I can facilitate or, connect you with anybody who might be able to help, just let me know. Thank you for doing it.
Yeah, I'll probably set up a quick call with you, Carla, if you have time, just to sort of nuts and bolts quickly. But and happy to work with anyone else who wants to.
Great, thank you.
And important.
Okay, member recruitment. I just want to remind you, you're all responsible for recruiting a great 3 or 4 new members. We're going to be very down on members soon. I just want to remind everybody, I think 4 of us term out in December, and we are currently down 4 members. So you're going to be struggling, actually not able to meet unless we get a number of new members on. So I know you all are connected to people that in your own areas that you think might be good. I would encourage you to reach out to them and see if they're interested. Okay,
Carla, real quick on that, do you guys have a recruitment handout? Sometimes that works, and I've put that out for other boards before. If you can create one, like what positions on the board are open and how somebody applies for a position, that kind of thing, and a handout is very helpful.
Good suggestion. Thank you, Lori, very much. Excellent. Our application process for the county is abysmal. I've been trying to get some movement on that to change it because it's very hard, but we can do a checklist on how to get through that. And that's a great suggestion. We'll get on a recruitment handout, and certainly thank you for offering to distribute. That sounds great too. And that goes for anybody else. I mean, we could even put it up in hospitals and certain health centers, or good suggestion. Thank you. Subcommittees, our 2 subcommittees are jail health or correctional health, and the youth mental health are still up and running and open for participation. So please revisit them. They're not I'm going to say this, and I hope I'm not going to be sorry for it. I think the time requirement is not going to be as intense as it has been. Those 2 committees have done wonderful work and with recommendations, and there's more to be done, but I think the timeline is a little better. And so, and certainly there's a lot that has already been accomplished in terms of understanding the landscape and what's involved in the players. So if you're inclined, please join a committee, become more active. And the last one is collaboration with other boards. That will leave for another time, but that is a goal for PHAB, because certainly our interests and our priority issues definitely do coincide with other boards. And I'll give you an update on that because I'm working on these things now. So we have come to public comment. Is there anybody in the public present who would like to make a comment? And if not, nobody in the public is present who would like to comment, we could, anything else from the board members would be more than welcome, or the county. No. Okay.
Melinda, did you want to ask your question? Or did you want me to ask that?
Did I have a question?
So there was a question about the subcommittees and if they are Brown Act meetings.
No, they are not Brown Act meetings. They do not keep minutes, and they do not, no, they don't have to be open to the public. One is a working committee, and that has public participation. And the other is a subcommittee, or yeah. Okay, well, in that case, we're going to finish on time, but I hope that you'll all think about these areas and give me any feedback that you would like. It would all be welcome. Even very constructive criticism is always welcome, or any other ideas. I thank you so much for being here and for participating. And I think that there are a lot of options for us going forward. And I think next meeting, we should be ready to make decisions on what we want to tackle based on the data that we'll bring back to you, and the plan for the next few months. So come with your ideas, think a lot about these areas, because you know our priority areas, and we're just going to pick from those. So thank you very much. And I look forward to seeing your faces on camera next time, if you're comfortable. Thank you.